Sadly, the first death that may reasonably be related to the vaccine has been reported recently. Um, there was a Florida doctor named Gregory Michael, who was evidently a very healthy 56-year-old OBGYN in Miami. And he received the Pfizer vaccine on December 18th. And about 3 days later, he started developing petechiae, which are small red dots in your skin caused by bleeding of the capillaries underneath the skin. This usually means that you're having some kind of coagulation problem. And then he went to the doctor and was admitted and diagnosed with something called ITP, or Idiopathic Thrombocytopenic Purpura, which is a condition where your immune system starts destroying your own platelets. And platelets are these small cells that are very important for clotting and stopping bleeding in your body. And so then he was admitted, and then they treated him for 2 weeks and were unable to raise his platelet levels. And unfortunately, he had a hemorrhagic stroke, which he died from on January 5th. So there's a couple of reasons why this may be related to the vaccine, and that's because it is known that certain vaccines cause ITP in very rare instances. And ITP can also be caused by many other things like cancer, usually lymphomas and leukemias, alcohol, several viral infections cause it, some genetic conditions cause it, and then chemicals, medications like antibiotics and diuretics can cause it. So the vaccine that we know causes ITP in rare instances is the MMR vaccine, and there's a large amount of data looking into this, and basically this book reviewed the data and established a causal relationship. So the MMR vaccines basically do cause thrombocytopenia in rare cases. It's 1 in 30 to 1 in 40,000 children. In most of these cases, it's easily treated, and the children recover from it. So this is not 1 in 30,000 or 1 in 40,000 children that get vaccinated die from ITP. That would be completely unacceptable. But it does, this thrombocytopenia does happen with this virus. And the other reason to believe that it may be related is that ITP is caused by COVID. COVID is the viral infection of COVID can cause ITP, and that's been noticed by several studies. And they note that in the introduction that ITP is caused by many other viral infections, including hepatitis, CMV, zoster, HIV, and Zika, and multiple cases of ITP secondary to COVID-19 have been reported. So those two things make it likely. We know that certain vaccines can cause ITP, and we know that COVID itself can cause ITP. So it's not unreasonable to think that a COVID vaccine that uses the COVID spike protein could cause ITP in patients whose immune systems are kind of susceptible to that. Luckily, it seems like it is a very low number. And so I think it's important to point out at this point that our choice is not between vaccine and no vaccine. Our choice is between vaccine and COVID. And so when you're going through kind of the risk analysis in your mind about whether or not to get the vaccine, you have to understand that we've had about close to 7 million doses of vaccines administered in the United States, and we've had one case of death that might be related to the vaccine. So worst case scenario, if this is related, and 7 million people have been vaccinated, your chance of death from this vaccine is 1. Let's do the math. Okay, so, and then we'll multiply it by 100 to get a percentage. So it's 0.0000149%. So it's extremely, extremely low. And so let's compare that to the risk of death from COVID. This is the IFR for COVID. the estimated IFR. IFR means infection fatality rate. That's opposed to CFR, which is case fatality rate. Case fatality rate means out of all the people we know for sure have COVID because we've tested them, this is their fatality rate. IFR means we know that there's a bunch of people that have like asymptomatic disease and never get tested, and we know that the infection rate is much higher than the case rate. So we estimate the infection rate, and then we can generate an infection fatality rate. So this infection fatality rate is much lower than the case fatality rate, but this is the number that you'd be interested in. If I were to be exposed to COVID and get infected, what is my chance of dying from it? So if you're young, 0 to 34 age, these people are healthy and young, your risk of dying is extremely low, 0.004%. And then, of course, it increases as you get older, and at 85 plus, it's like 30% mortality rate from COVID. So even if you're in this healthiest, least likely group, this number is about 1,000 times higher than this number. So the vaccine is like almost 1,000 times safer in terms of mortality rate than COVID. And that's not to mention all the secondary things that COVID can cause, long-term heart problems, lung problems, that kind of stuff. So when we're thinking about the risk, if the risk was you take the vaccine or you're totally fine, of course, don't take the vaccine. There's no risk to doing nothing. But the risk of doing nothing is that you'll be exposed to COVID and get COVID. And that's a much higher risk. Because vaccines have to be very safe because we're deploying them to millions of people, we want to keep track of the adverse events. And so the government set up this thing called the Vaccine Adverse Event Reporting System. And so anyone can report an adverse event. Like if I had an adverse event from my vaccination, I could just go report it. Now that means that these reports are not verified. Anyone can go there and just submit whatever they want, and it would be recorded. Now the major ones, the CDC it will get investigated. Like this physician's death obviously will be investigated and is being investigated. And you can search this data set yourself. Like anyone can go here. You don't need special access. You just need to agree to their terms of service. And then if you look in this, you can search for. And I figured out when I did this that you have to search by the ID if you want to get all the information. And then we're just interested in the COVID vaccine. But you could search for whatever vaccine you wanted here. Yep, COVID. So we'll select all COVID vaccines, and then we're interested in deaths, and then we'll ask for the query. Okay, so it gives you 11 total deaths. And so if you look at, I've kind of reviewed this before I started recording this, and almost all of these are in nursing home patients who were in very poor health. And so a patient had decreased oral intake after the vaccination and died 5 days after administration. This patient had advanced dementia, was on hospice. So did the vaccine cause this death? Probably not. And most of these are the same. Someone had a heart attack. That is probably not related to the vaccine. But so you can search yourself and look at these. And these are, of course, not verified. We don't know if these, I don't see why anyone would lie about this and report it. But just pretty much anyone can report into this system. And they will, if they notice a large number of adverse events with a vaccine, they're going to investigate that. So anyways, this is a very tragic story, but I think we need to kind of be aware that vaccines are not a zero risk proposition. They're extremely low risk proposition. And we don't know whether this was related to the vaccine or not. That is being investigated. But basically, it's very hard to establish a causal relationship based on one event. If there are multiple events like this, then you can, just like there were for the MMR, after a while you can link a causal relationship. but a single event is very hard to say it's causally related. But there are some reasons to believe that it might be. Um, and anyway, the bottom line is it is way safer than the um, getting the actual disease, and that's why I personally was vaccinated myself, and that's why most healthcare workers are being vaccinated. And especially if you're in this high risk group, you should absolutely be vaccinated. But yeah, this is a case of ITP after vaccination, which may be related, and it's a sad story. But I thought we should discuss it. And thanks for watching. If you have any questions, comment below.